The math is really simple. For us in Africa, we carry 25% of the global disease burden, only have 3% of the healthcare workforce, and only 1% of the global health financing. You know, we've made a big bet on data, and that bet is foundational with MEDITECH Expands. We've taken the data out of the EHR, built a large EHR repository, because what we're focused on is moving that healthcare upstream. Because in order for us to address our challenges, proactive preventative care is the only way to do it. In terms of the relationship we have with MEDITECH, for us it's understanding how the data is captured in the electronic health record. For us, we're not looking at it as just an operational system. Absolutely, we get all of the benefits of it being an operational system, right? It allows us to gain efficiencies, it allows us to automate a lot of the work that the doctors take on. But for us, it's a learning engine for our health system because we extract that data. Every patient interaction becomes a learning moment. We capture all of that data, we extract that data, and we put it into our EHR repository. Then we mine that data, and we look for trends, we look for patterns, etc. Those learnings are then incorporated back into Expanse. So what we've done now is we've democratized the knowledge across the health system. And so what you've created is a continuous learning loop. So a great example of this in terms of at the moment care at the bedside is actually in cancer. Cancer is growing at an exponential rate in Africa. And studies show that 65% of patients in Africa that have cancer experience psychological distress. However, we capture all of this data now in healthcare, but a lot of it goes unused. I quoted the stat 97%. And so what we've done is for our cancer patients, we've incorporated something called DART. It is the Distress Assessment and Response Tool. We've incorporated it directly into MEDITECH Expands. So when oncology patients come in for routine visits, we automatically screen them. And those results are captured in the system. And if distress is identified, it triggers an action automatically. And so now what you have is a moment of care that happens automatically from data that usually goes unused. And I think what's even more important about this is it's not a medical determinant. It is a mental health determinant that we often don't look at. Data becomes most powerful when you're able, in the moment, to change an action at the bedside.